Well, April is National Head and Neck Cancer Awareness Month, at a time to raise awareness about the most common forms of these cancers. Joined now this morning by Dr. Brendan Gaylis of the Scripps Cancer Center. Doctor, great to see you. Thank you for coming today.
Thank you for having me.
So we're seeing a rise in certain types of cancers. If you can explain what you're noticing, mouth and throat cancers, is that right?
Correct, yes. Well, firstly, I'd like to make note of a statistic that's just been recently released by the American Cancer Society, showing that overall for 2026, the 5-year survival rate for all cancers of the human body is at about 70%.
Wow.
Which is a significant advance and makes the diagnosis of cancer a little less daunting, even though cancer remains a very deadly disease for human beings. Specifically to head and neck cancer, we've seen a consistent increase in the incidence of throat cancer for the last about 25 years. And this is all, a lot of it is due to a sexually transmitted virus called the human papilloma virus, which buries itself in the tissues of the tonsils and the back of the tongue, and ultimately in some people develops into malignant tumors.
Oh, wow. Okay, so this is a sexually transmitted virus that is a cancer, or turns into a cancer.
That eventually turns into a cancer.
Oh, wow. Okay, so what can people do about this? I mean, it's important to know that the numbers are on the rise for this.
Yeah, so we have about, there are probably going to be about 30,000 cases this year nationwide.
Wow.
Altogether, there are about 60,000 cases of mouth and throat cancer on a yearly basis. So at least half or even more than half are due to this particular virus. Wow. The good news is that we have a prevention for it. And the prevention is a vaccine called the Gardasil vaccine, which needs to be given to children, adolescents, between the ages of 9 and 12 usually. That's when the recommendations are to start, but can be given up to the age of 26 and even in certain circumstances up to the age of 45 for people that are at very high risk. So the vaccine is extremely effective, not 100%, but ultimately it will take away this epidemic.
And what do people need to look out for? I mean, what are some of the signs, symptoms if they need to come get checked?
Yeah, so unfortunately, the tumors, when they develop, are often quite silent because they sit at the back of the throat, they grow slowly, and they don't present with a lot of symptoms until they've spread.
I see.
And most of the spread are to lymph glands in the neck. So it's oftentimes somebody becomes aware of a swelling in the neck. Occasionally they may have difficulty swallowing or pain in their throat or a little bleeding. That's unusual, but mostly the neck disease presents with a lump.
Okay, and then at that point it's already spread,
Well, it's spread, but it's still fortunately extremely treatable. We have very high cure rates with treatment, with radiation, with surgery, with chemotherapy. So it's a very treatable disease, but comes at a big price.
Yeah, and obviously for now, even with the study that you just mentioned, the fact that cancers, there are more advanced treatments, people are getting checked more often. Why do you think we have kind of, more hope after someone's diagnosed with cancer these days?
The reason for more hope is earlier detection, because people are aware. So, the best thing if you do get a cancer is to find it early. Even better than that is to prevent it from ever happening. And in this particular case, we have a strong prevention tool. But I think that, healthy lifestyle, healthy eating, exercise, things like that are going to continue to help with decreased incidences of these tumors. And the therapies that are coming out in the terms of immunotherapy, we're revolutionizing the treatment of cancer. We're understanding the molecular biology of these tumors, and this is giving us a tremendous advantage in treatment.
Okay, glad to hear that, Doctor. Thank you for doing the work that you do. For our viewers at home, if they have questions or want to come see a doctor about something, maybe, what's a good website? Where should they go?
The best website from my institution is scripps.org/cancer. There's a wealth of information on head and neck cancers, on all other tumors, malignant tumors of the body. So please visit that site.
Awareness is so important, so we appreciate it. Thank you.